Hi, everyone. This is Dan Toner, the health insurance broker for Access. I'm here to talk about open enrollment. Today is the 9th. Tomorrow is the 10th. We're going to start open enrollment beginning tomorrow, Wednesday, and we're going to try to wrap it up by next Wednesday, the 17th. 1 week should be enough to kind of review the stuff, answer any questions. If you need more time, reach out and let me know, but I'm going to provide my contact detail and hopefully we can get this in. We are changing insurance companies, so it's important to get your decision as early as possible. On the screen, I'm showing you the new 2026 employee summary for the Access family of plans. In order to be eligible, you have to work 25 or more hours a week. That's consistent. If you have breaks of employment, you're not eligible for health insurance. You have to, for a new hire, you have to satisfy a 90-day waiting period, and then you'll have the opportunity to enroll under coverage. If you are waiving on the January renewal, you can't come back on until next January unless you have a qualifying event. Those are examples of a qualifying event. The summary for 2026 is we are changing all the insurance plans. We're offering 4 health insurance plans from United that I'm going to go over in a second. We're offering a voluntary dental plan from United Healthcare and a voluntary vision. There is a contribution from the company towards the medical, and the employees pay the costs for the dental and vision. On the health policies, a couple things about United Healthcare. Number one, all of the policies have 100% coverage for your annual well visits. No deductible, no copay. You don't need referrals to see specialists on any of the health plans. It is a national network of doctors and hospitals. All 4 plans use what's called the Choice Network. The Choice Network is United's largest network all throughout the United States. In New Jersey, you'll see a Choice doctor. You can go into New York and see a Choice doctor, Philadelphia, Connecticut, California, Florida, etc. So it is a national network. And again, you don't need referrals. So there are 4 plans because there's sort of 4 different price points. Some of you expect a lot of hospital and surgery bills. Some of you don't. So we're giving everyone a choice to help save some money. I'll do my best to summarize this, and you can contact me with any additional questions. Keep in mind one thing on the email that I am sending, you will have a full detailed benefit summary for each of the plans. So this is a quick overview. There's a 10-page SBC, summary of benefit coverage, for each of the plans listed in the body of the email. Okay, real quick, I'm going to go over 3 sort of traditional plans as we know, and a brand new plan called Surest Last. Okay, on the 3 different plans, you'll notice one thing about United Healthcare. Everything is the same for their primary care and specialist. $25 copay. There's no deductible. You pay the copay. United pays 100% on top of that. When you have things like X-ray and lab, it's free on all 3 plans. When you go to an urgent care center, it's the same $50 copay on all 3 plans. When you go for prescriptions, it's the same cost. $10 is the maximum you pay for a generic 30-day supply of medication, and your name brand is either going to be $35 or $75, depending on if it's preferred or non-preferred. That's your 30-day cap you'll pay each month for a copay. Specialty drugs are ones that are thousands of dollars a month, and you have a maximum cost of $250 once it's pre-authorized. Okay? So you'll notice one thing, all of those benefits are the same across the board. What's different about each of the plans is treatment of hospital, meaning if you're staying overnight, surgery, like outpatient surgery, emergency room, and then things like imaging, CAT scans, PET scans, and MRIs. So hospital, surgery, imaging, and emergency room. That's where the difference is for the 3 plans. On the lower costing option, and by the way, you can see your per paycheck deduction at the bottom here. And as it gets higher, the plans get a little richer, you pay more money. The first base plan is simply going to say for all those big things, hospital surgeries, MRIs, and emergency room, there's a $6,000 deductible. You're required to pay 30% on top of that, but you cannot spend more than $8,150. That's called your maximum out of pocket, no matter what happens to you during the 12 months. Someone else in your family owes that same thing. And in New Jersey, if you meet your out of pocket and a spouse meets the out of pocket, the kids don't have to meet anything. That's the definition of a family. It doesn't mean if you're a family, one person owes the 16. It means two people owes 8150 at maximum. So if you're a single, like I think many of the employees are covered as single, that's what you would owe. Worst case scenario, no matter what happens to you for all those big bills. And again, those things are waived and you just pay the copay for the other services. The second plan is probably a little closer to the Omnia Silver or the $1,500 Aetna deductible that some of you have. It's sort of a match with, by the way, a lower cost than Aetna and Blue Cross. And again, all those copays are the same. What's different? Again, hospitals, surgeries, MRIs, and emergency room, there's a $1,500 deductible. You're required to pay 30%, and your maximum is $6,000. So again, a little richer plan, you pay a little bit more to United Healthcare because you theoretically owe less for the larger claims. And the last plan is the richest plan that's simply going to say for those larger claims, you have a $3,000 deductible, and then you owe nothing for those things. Like a hospital bill, you owe nothing after the deductible, or surgery, you owe nothing after the deductible. So that's where the zero comes in. You still have to meet your deductible, but you don't owe anything on top of that for those larger claims. Therefore, it's the highest premium because some of you may expect more bills. Okay, so those are the first three plans. The last plan is pretty unique. It's called Surest. And probably the best way I can describe it is I'm going to pull, I have a description right in here. This is a written description. It's a copay only plan. There's no deductibles and no coinsurance. What that means is you have predictable pricing. So I have a little copy of a flyer here for Surest. And by the way, if you're interested in the Surest plan, you can take a picture of the barcode. The best way I can describe it is, let's say you had something like a MRI. When you go to your Surest app, you pick up the app, you type in your area and you type in what procedure you're going to have. It will then tell you the range of costs. And it'll say something like you owe anywhere from, well, actually, I think I have it listed here for MRIs. Let's go jump right back. The copays will run anywhere from $100 to $1,400. So what's important about Surest is they're going to tell you if you get an MRI at this place, it's $800, and it's this place, it's $1,200. So it's going to give you the ability to shop within the United facilities and actually save money if you can. So that's what Surest is about. Now, when you look at down, they do with that with all benefits. So for example, when you go to a primary care, you're going to find some that are $20, 25, 30, 35 is going to go all the way up to 100. Specialist, 20 all the way up to 100. Instead of paying a $75 copay, the Surest concept is going to say, well, there's some specialists that are 20, 25, 30, 40, 50. Why not take a look at that? And if your provider is in the Surest, well, they're going to be in the network, but if your provider is a lower copay than the other plans, you may think that the Surest is a better plan. And you can see from a pricing standpoint, it's pretty identical to the middle plan. It's just a different concept. Okay, so you can see the ranges of prices. All right, it's brand new from United, but it's been around for a while. They just brought it to New Jersey for businesses under 100 people now. It's been very successful for them, and we've been enrolling people on it. Okay. So the dental and vision are currently with Blue Cross. However, we're going to change to United Healthcare. This is a copy of the benefits. You have 100% coverage for checkups, cleanings, and exams, 80% coverage for things like fillings and surgery, and 50% coverage for the major stuff. Everyone that's covered gets a $1,500 benefit. So when they pay out a claim, so they paid $200 office visit at 100%, that means you have $1,300 left for you to use for other services. You can go out of the network, but you're going to owe more. The name of the network is called the National Options PPO. So online, I'm going to go over that in a second. When you look up your doctors, you look up the National Options Network and you can locate an in-network provider. In terms of vision services are not covered unless you have, under your medical, unless you have a condition like glaucoma, for example. If you're looking for routine eye, I want my eyes checked every year. I wear glasses or frames, or I want reimbursement for my lenses, frames, or contacts, you need a vision plan. They're all independent, so you can waive medical and buy dental. You can have family for vision and single for dental. They're all independent of each other. On the vision, you're using a United Healthcare provider. When you go once a year for your exam, you'll pay a $10 copay. They pay the balance at 100%. If you're getting a pair of glasses, you'll pay a $25 copay for the lens, and then they're going to give you $150 plus 20% off the rest of the charge. So really, it's a combination of a copay for certain services, cash reimbursement, and then a percentage off, and at a rate of $1.54 a week. You can't beat it. So keep in mind, the vision is a pretty good deal. We're just going to move, no disrespect to Horizon, but United gave us a better deal. This is a copy of the example, the benefits, by the way, for the vision. When you can go now to my UHC to look up your doctor, there's a find a provider. When you get into that medical, you're going to go in and shop around, and you can go into the medical directory, employer plans, shop around, and then you'll see the choice network on the drop down. Then you can look nationwide, Jersey, New York, etc. On the dental, find a dentist, look for the national options PPO, and for vision, you'll click the vision provider, and there's no name of the network. It's just all the providers are in there. When you get your ID number from us after you enroll, make sure you go to UHC, my UHC, and register. Click in and register. Once you have your ID number, you can download an ID card, see a copy of your benefits, explanation of benefits for every claim that's paid, etc. The contact numbers for United Healthcare are here, and there's the website. My team, this is me, Dan Toner, and this is how to contact me. We are your broker at FFP Insurance Services, and the rest of it are our annual compliance that you need to be notified about, particularly Section 125, which, by the way, means every deduction that's coming out of for your health insurance is coming out of your paycheck pre-tax. Speaking of deductions, this is the most important part. This 3-page sheet is what we need from you to make your election. You're going to write your name at the top. Under medical, you will check off your election right at the bottom. If you want to decline, you click here, sign and date. If you want single coverage for this plan, you check it off, sign and date. Coverage is for you. If you want to add you and a spouse, if you want to put yourself on with children, all children are covered with one price as long as they're under the age of 26. And the employee's family is you, spouse, and one or more children up to the age of 26. You'll make your same selection on dental, and you'll make your selection on vision. These 3 sheets need to get to Alex by Wednesday, December 17th. Okay, that's it for me. You have my contact information here. I wish you got a great upcoming holiday, and thanks again for everything.